Do you have a diabetes problem? It is possible to solve it naturally. You will be surprised by the effects of eating these 6 foods we discussed in our video every day. Don't forget to follow and subscribe to my channel for more videos and content. For this and similar content, please specify in the comments. Diabetes mellitus, commonly known as diabetes, is a metabolic disorder characterized by the body's inability to regulate and control blood sugar levels effectively. Normally, the pancreas, an organ in the body, secretes a hormone called insulin to manage blood glucose, sugar, levels. Insulin facilitates the transport of glucose into cells for energy production. However, in diabetes, this process is disrupted. Diabetes typically arises due to either insufficient insulin production or the body's resistance to insulin. In cases of insulin deficiency, the pancreas fails to produce enough insulin. In insulin resistance, cells are unable to effectively use insulin. As a result, blood glucose levels rise, hyperglycemia, and cells do not receive sufficient energy. Several risk factors are associated with diabetes, including genetic predisposition, obesity, sedentary lifestyle, poor dietary habits, and certain viral infections. Additionally, advancing age is a significant risk factor for type 2 diabetes. Diabetes can be categorized into 3 main types. Type 1 diabetes. Type 1 diabetes often develops in childhood or young adulthood. The immune system mistakenly destroys insulin-producing cells in the pancreas. Therefore, individuals with type 1 diabetes require lifelong insulin injections or insulin pumps. Type 2 diabetes. Type 2 diabetes typically occurs in adults and the elderly, but with the increasing prevalence of obesity, it is also becoming more common in childhood. Type 2 diabetes is often associated with insulin resistance, and over time, the pancreas may fail to produce sufficient insulin. Treatment involves dietary changes, exercise, and sometimes medications. Gestational diabetes. This type of diabetes develops during pregnancy and generally resolves after childbirth. However, women with gestational diabetes and their children are at increased risk of developing type 2 diabetes later in life. In addition to these, there are other rare types of diabetes. These include MODY, maturity-onset diabetes of the young, a hereditary type similar to type 2 diabetes, and LADA, latent autoimmune diabetes of adults, which resembles insulin-dependent type 1 diabetes. The treatment of diabetes depends on the type of diabetes, an individual's lifestyle, and other health conditions. Generally, management involves dietary modifications, regular physical activity, monitoring blood sugar levels, and medications, such as insulin or oral anti-diabetic drugs. In conclusion, diabetes results from disruptions in complex metabolic processes in the body. It is a significant public health concern, but with early diagnosis and effective treatment, it can be managed. Lifestyle changes and regular health checkups are critical for the prevention and management of diabetes. People with diabetes should pay careful attention to their diet to keep their blood sugar levels stable. Certain foods or eating habits can be detrimental to individuals with diabetes. Here are some dietary recommendations for people with diabetes. High sugar foods and beverages. It's important for individuals with diabetes to avoid foods containing natural or processed sugars to help control blood sugar levels. Examples include sugar-sweetened beverages, candies, jams, cakes, and packaged snacks. High carbohydrate foods. Carbohydrates are converted into glucose during digestion and can raise blood sugar levels. For people with diabetes, opting for fiber-rich whole grains and complex carbohydrates is important over refined carbohydrates. Foods like white bread, white rice, and sugary snacks with high glycemic index should be avoided. Saturated fats and trans fats. Saturated fats and trans fats can have negative effects on health and increase the risk of heart disease. Therefore, individuals with diabetes should opt for healthy fat sources such as olive oil, avocado, and fatty fish rich in omega-3 fatty acids. Salt. High salt intake can increase blood pressure and negatively affect heart health. People with diabetes should pay attention to the high salt content in processed foods and aim to limit salt intake. Alcohol. Alcohol can impact blood sugar levels and increase the risk of hypoglycemia, low blood sugar. Additionally, alcohol contributes to obesity and liver problems due to its high caloric and low nutritional value. People with diabetes should consume alcohol cautiously and in moderation. Uncontrolled portions. Portion control is crucial for individuals with diabetes. Overeating can spike blood sugar levels and lead to weight gain. Eating balanced and moderate portions helps in better management of blood sugar levels. Low-fiber foods. Fiber-rich foods slow down digestion, resulting in a more gradual increase in blood sugar levels and promoting digestive health. Recommended fiber sources for people with diabetes include vegetables, fruits, legumes, and whole grain products. Individuals with diabetes should follow personalized meal plans designed by a dietitian or healthcare professional. A healthy eating pattern, combined with appropriate medication use and regular physical activity, plays a significant role in managing diabetes effectively. High blood sugar, hyperglycemia, signs and symptoms. Frequent urination, polyuria. High blood sugar levels can lead to increased urine production as the body tries to eliminate excess glucose through urine. This can result in frequent trips to the bathroom. Increased thirst, polydipsia. Excessive urination due to high blood sugar levels can cause dehydration, leading to persistent feelings of thirst. Fatigue and weakness. Cells may not receive enough glucose for energy due to insulin resistance or deficiency, resulting in persistent fatigue and weakness. Blurred vision. High blood sugar levels can cause temporary changes in the shape of the lens of the eye, leading to blurred vision. Dry mouth and increased hunger. Dehydration from increased urination can cause dry mouth, while cells may signal hunger due to lack of usable glucose. Slow healing wounds. High blood sugar can impair circulation and nerve function, leading to slower wound healing. Acetone breath. In severe cases of hyperglycemia, the body may break down fat for energy, producing ketones that can lead to a distinctive fruity or acetone-like breath odor. Low blood sugar, hypoglycemia, signs and symptoms. Sudden and intense hunger. Hypoglycemia triggers hunger due to the body's need for glucose. Sweating. The body responds to low blood sugar levels by releasing stress hormones, which can cause sweating even when not physically active. Trembling or shakiness. Low blood sugar can lead to tremors or shakiness, especially in the hands or legs. Rapid heartbeat, tachycardia. Hypoglycemia can cause the heart to beat faster as a response to low glucose levels. Headache and dizziness. Insufficient glucose to fuel the brain can result in headaches, dizziness, or lightheadedness. Blurry vision. Hypoglycemia can affect vision, causing temporary blurring. Mood changes. Irritability, anxiety, confusion, or other behavioral changes may occur with low blood sugar levels. Monitoring blood sugar levels. The most accurate way to determine if blood sugar levels are high or low is through regular blood sugar monitoring using a glucometer. People with diabetes or insulin resistance often monitor their blood sugar levels at home using these devices. Healthcare providers can establish target blood sugar ranges for individuals and recommend when and how often to check blood sugar levels based on individual health conditions and treatment plans. Managing conditions like diabetes or insulin resistance involves adopting a healthy lifestyle, engaging in regular physical activity, eating a balanced diet, and monitoring blood sugar levels consistently. Recognizing the signs and symptoms of hypoglycemia or hyperglycemia is crucial for prompt intervention and effective management of these conditions. Here are 6 foods that are essential for people with diabetes to include in their daily diet, along with examples. 1. Leafy green vegetables. Vegetables like spinach, kale, lettuce, and broccoli are rich in fiber and low in carbohydrates, making them ideal for stabilizing blood sugar levels. They are also packed with essential vitamins and minerals. For example, you can have a salad or cooked greens with dinner. 2. Whole grains. Opt for whole grain foods such as whole wheat bread, brown rice, bulgur, or oats instead of refined grains. Whole grains are high in fiber, which helps slow down digestion and prevent rapid spikes in blood sugar. For breakfast, consider oatmeal or whole grain bread. 3. Protein sources. Include protein-rich foods like salmon, tuna, turkey breast, tofu, or lean poultry in your meals. Protein slows down digestion, promotes satiety, and helps stabilize blood sugar levels. Choose these protein sources for lunch or dinner. 4. Olive oil. Use olive oil as a healthy fat source in cooking or dressing salads. Olive oil is rich in monounsaturated fats, which are beneficial for heart health and can help prevent blood sugar spikes. 5. Raw almonds or nuts. Snack on raw almonds or other nuts like walnuts or cashews. Nuts are high in healthy fats, protein, and fiber, making them a great choice for managing blood sugar levels and promoting fullness between meals. 6. Seeds and legumes. Incorporate seeds such as pumpkin seeds or chia seeds, as well as legumes like lentils or chickpeas, into your meals. These foods are rich in fiber, protein, and essential nutrients, which can help stabilize blood sugar levels and support overall health. Don't forget to subscribe and like my channel. If you want other videos and content, please specify in the comments.